Welcome to our Preceptor modules. This is Module 4, Navigating Crucial Conversations. Today's activity will provide 0.25 contact hours of continuing nursing education credit, or CNE credit, and the Michigan State University College of Nursing is accredited through the American Nurses Credentialing Center's Commission on Accreditation. Completion criteria for this continuing education activity includes participation in the learning activity, achievement of 80% or greater on the post-session test, and completion of the post-session evaluation. Our learning outcome today is that upon completion of the learning activity, participants will have improved knowledge and provide a practice application example of navigating a crucial conversation. So again, welcome to this module, Navigating Crucial Conversations. My name is Larissa Miller, and I'm the Coordinator of Professional Development and Continuing Education at the Michigan State University College of Nursing. This module was developed in conjunction with Dr. Catherine Kowalski. So let's get started. Is conflict resolution a natural skill? It absolutely is not. In fact, experts will tell you that only 10% of healthcare workers feel skilled enough to have a crucial conversation. So what happens in healthcare if we don't have crucial conversations? Well, there's patient safety concerns. We can even have poor patient outcomes due to delayed or avoided communication, often in the form of not up to quality handoffs. If we do have crucial conversations, we can flip that around. This becomes better patient outcomes, better communication, and team members that feel like they can have crucial conversations ultimately feel more buy-in and more connectedness within the organization. As a preceptor, you'll be having crucial conversations with students, absolutely a part of the healthcare team, and you'll be helping them navigate these conversations with other healthcare workers. So crucial conversations with students is so important because as a preceptor, you're interacting with novice learners. They're not only developing nursing skills, but they're developing their professionalism skills as well. So novice learners want to start cementing their habits, and they want to be cementing the ones that are correct. Without intervening with crucial conversations, those habits, if they're not corrected, they could be actually incorrect habits. So once that pattern is established, it's difficult to redirect. So from the beginning, having those crucial conversations and navigating those with your students will ultimately lead to their improved sense of professionalism and their future success. Again, this ultimately turns around in healthcare to direct impacts on patient safety, patient outcomes, and communication throughout the healthcare team. When we have these conversations and we start modeling a controlled and expected and structured conversation, again, not only does this role model professionalism, but it helps the student reflect on how they are having these conversations, and that's critical thinking. So this is feedback into their role development throughout just these casual or crucial conversations. When the student is allowed to practice navigating these conversations, they're improving their critical thinking skills, and when they feel better ownership of this, they ultimately will have increased job satisfaction. Increased job satisfaction is directly tied to role retention, and that's what we're hoping for our newest learners. So in this pathway to crucial conversations, there's actually 10 phases or 10 topics to consider. So in this presentation, we'll be walking through each of these 10 topics and giving you some examples of what this might sound like in your conversations. Here's the 10 topics overall. Start with the heart, create a safe environment, state your concerns, focus on results, master your story, stay focused, listen actively, apply consequences, explore others' concerns, and finally, move to action. So let's start with the first one, and that's start with the heart. When you can be genuine and open and empathetic with the student in these crucial conversations, showing that genuine care and concern builds connection. Here's what that might sound like. I value our teamwork and I value our relationship. I really want to address something that's been on my mind. By stating the importance of that with true heart, that helps you, again, kind of diffuse the emotional content of crucial conversations. The second topic is create a safe environment. Knowing what a safe space looks and feels like will help both sides feel more comfortable to engage and also express themselves throughout the conversation. Here's something that it might sound like. There's mental space and physical space. For mental space, you might want to say, I want to make sure that we're ready to discuss this. I want to make sure that we can talk openly without judgment. Mental space, a mental safe environment. Physical space, or a physical safe environment. Is now a good time? Where can we talk that's comfortable? This is probably likely not going to be in the patient room, at a busy nurse's station, or when everyone's trying to get to lunch. So make sure you're creating a safe physical environment as well. Maybe it's a quieter space, something removed from the situation, or it might even be a little bit later in the day. The third topic is state your concerns. Clearly outline your concerns and your viewpoints, and be specific. Focus on one issue at a time. Crucial conversations that have 20 items to correct all at once become really heavy and laden with confusion of which one's the priority. So even if there are multiple issues, pick a priority, be specific, and focus on one issue at a time. Here's what that might sound like. I'd like to discuss how we're going to coordinate report and handoffs. We want to avoid any delays in care. Report and handoff sounds like communication at the end of the shift, one issue, and why is it important to avoid those delays in care. The next topic is to focus on results. Keep the conversation focused on achieving positive outcomes. Maybe set a mutual goal at the beginning of the conversation. When you're focused on results, this will also help you avoid side conversations or comments about things that aren't related to the topic at hand. So for focusing on results, it might sound like something like this. Our shared goal is to provide the best possible care for our patients. Let's discuss how we can achieve that through better handoffs at the end of our shift. Again, focusing on the result, that's focused on achieving a positive outcome. The next topic is master your story. Retrace your path and talk about the steps that led you to this crucial conversation. Things that you've observed, things that you've seen. How have you come to this conclusion that this conversation needed to happen? So mastering your story might sound something like this. I may have assumed that you were upset with that other nurse. I thought I heard you raise your voice when I looked down the hall, but I want to hear your perspective on this. So retrace your steps. Talk about those objective things that you may have heard or even written or found as a data piece. Master your story. The next topic is to stay focused. Again, keep the conversation focused on the issue at hand and help the student stay on task as well. It's super natural to be defensive and maybe even say things like, well, so-and-so did it this way, or I learned it that way in class, or, well, somebody else told me this. So stay focused and help the student stay focused too. That might sound something like this. We can set up another time to talk about the IV pump issue, but I'd like to stay focused on the communication piece right now to improve your handoff at the end of the shift. The next topic is to listen actively. And this is giving the student a chance to express themselves and listen attentively. We want to gather their perspective and understand their rationales without interrupting, and also without preparing a response automatically in your head. This takes practice to listen actively. Engage your full body in listening. That may mean putting things down and having quiet hands, full eye contact, facing the student, not multitasking. These are all active listening skills. So this might sound something like this. Now I want to hear your thoughts on this. I'm going to sit back and I'd like you to share your story. Can you tell me what happened? And then do it. Allow that student a chance to respond. That's listening actively. Another topic is applying consequences. And this is not just negative consequences. This can be positive consequences as well. What will happen as a result of this crucial conversation? These might be positive and negative to help kind of frame why it's so important. This usually sounds something like this. If we can improve how we hand off report on titrating IV drips, the patient will get more accurate dosing. So that's a positive outcome of learning that skill of titrating IV drips or reporting off at the end of the shift. The next topic is exploring others' concerns. This goes back to telling each side of the story. Seek to understand the motivations and the concerns of the student. Really listen again. At the end of that listening, go ahead and rephrase and restate their story and check for understanding. So this makes sure that the student knows that they've been heard, but it also lets you check that you have been listening. So explore each other's concerns. It might sound something like this. I observed during our shift yesterday that you seemed a bit frustrated when the other nurse suggested a different approach to report. Can you tell me more about that moment? Is this right? Again, exploring each side. Rephrase, restate, and check for understanding. The next topic is to move to action. After you've had this conversation and you've gotten both sides, collaborate on finding the specific solution and the specific next steps to alleviate the problem. Once you've talked about each side of the story, make sure that you both understand what those action steps might be. It may sound something like this. So based on our discussion, it seems like the IV pumps need to be cleared at 6 o'clock, and so we can include it in report at 7 o'clock. Would you like to announce that to the group, or would you like me to? Action steps. So those were the 10 steps to navigating crucial conversations. Let's summarize them again. Remember to start with heart. Create a safe environment, both mentally and physically. State your concern, be specific. Focus on results. Why is this important? Where will it get us if we have this conversation successfully? Master your story. Retrace those steps. Include the data pieces that you've collected. Stay focused. Stay focused on the one topic, not 20, and make sure that we're not getting distracted into other areas. Listen actively. This is mind, body, and spirit, eye contact, quiet hands, and listening with an open mind, not preparing your response. Applying consequences, both positive and negative. What will happen? What are the good things that will happen if we finish this conversation successfully? Exploring others' concerns, checking for understanding. And the last step is to move to action. Decide on the action steps so that you have a really positive outgrowth of this crucial conversation. This is the conclusion of our module. We hope that this has really helped to walk through those 10 steps and 10 facets of crucial conversations. What are your action items? What do you need more information on? Which point really zinged with you that you're going to include in your next crucial conversation? Thank you so much for tackling this content, and please let us know if you have any questions about this material. At this time, we'll be moving into our post-session evaluation and post-test. So please grab your phones and open up that camera, and please scan this QR code on the screen to go to the post-session test and evaluation. Please complete both the post-session test and the evaluation to provide feedback on the activity and also to receive your contact hour certificate electronically to this email address that you provide. At this time, this will be the conclusion of our learning module, Navigating Crucial Conversations. Thank you so much for joining us, and we hope to see you at the next learning activity.